Thank you again. This is a great conversation, and it makes me so proud to be in this wonderful profession, my friends, because you're going to see where we were and where we are and where we're heading. And I think it's a great reminder of all the great tools and technology that's out there. I know some of us are a little bit afraid of change, right? It's normal. It's human nature to be afraid of change. But with our great friends at Zomedica, moving the needle in the way it should be, very excited to share with you some of those applications that hopefully you'll be able to implement into practice or wherever you are, and just kind of enabling yourself to be a better and stronger pet parent. So thank you so much again, Zomedica, for having such a wonderful portfolio. My fur babies, thank you for all the great things that you have, from the Calmer Canine to the Assisi Loop. So of course that we have what we use at our practice, we're going to talk about in a little bit. So yeah, just as mentioned by Susan, I'm the CBO of DVM 360. So go ahead and make sure you follow us there. Get the publication completely free. We have our veterinary conferences that you're welcome to attend. Our friends at Zomedica are at all of our shows. So we're in the we have 5 shows around the country. We're going to be in Kansas City coming up at the end of August. So we'd love to see you there. Great continuing education. It's all about networking. Oh my gosh, stop what you're doing, everybody. And please look at this slide right now and put in the chat, ooh or ah, and the Q&A box. How adorable. My name is Adam Christman, and I'm a doxaholic, and I'm so proud of it. But on the far left is Clark W. Griswold. And then here's our beautiful, handsome King Connor, because my senior ween, Chelsea, recently passed away. And then we have our blonde cutie, Carl. And on the far right is our new addition. That's a standard wire hair dachshund, by the way. I forgot how big they are. He's 30 pounds, and that's Capone. He's enormous and beautiful, and he's the bouncer. And I always like to look at this picture, and I hope to encourage you all to always stay focused and grounded to your why. They're my why. They're the reason why I get up in the morning and do what I do as a veterinarian. So always hold true to your why, because life could be a little, chaotic or whatnot. So yes, thank you, Natasha. She says super cute. Thanks, Natasha, my favorite friend already. Hey, put in the Q&A chat. Does anyone know what this is? Comment below, or hey, even better, were you extra bougie or fancy if you had one of these? I remember when I was in high school, I didn't have one of these. I had friends that had them, but I thought, wow, you're cool because, that's pretty fancy. I didn't know what that was. But if you don't know, that's called a beeper. And that was kind of the first way of us communicating with one another, trying to figure out, like, you had an important phone call coming in. Natasha says a pager, right? Carrie had one, a pager in vet school when I started practice. Oh my gosh, Carrie, see, welcome. See, I'm with you on that. Teresa says that she used it in vet school on call. Yeah, so we used it a lot in medical health professionals, but then when you're in high school, you're really cool, either that or like you just seemed important. But that was kind of the beginning of communication. Can you imagine, like, just put yourself in their shoes, like Carrie was just using it as a veterinarian, as a beeper. That was the only mode of communication that we've had, to be either paged to be in another room. But what would we do? I mean, with us, like me growing up, we just came home after school, and after, when it got dark out, we would just be expected to come home for dinner, and that's how we rolled. And we also drank water from the hose outside too, and that's like how we are as Gen X babies. I don't know if you're a Gen Xer out there, but if you know what I'm talking about. So yeah, the beeper was really a really cool thing. But then cut to the cell phone, the very first cell phone, and you were probably extra fancier if you had a higher antenna, just because the bigger the antenna, the closer you are to communication of the world. But again, I share this with you about technology and how we involved and communicate with one another, because this is so crucial on how we communicate to our clients in and out of the exam room now. Now we have the virtual space, but back then we didn't. This is the only form. And you may agree or disagree with this, like, hey, it was easier back then. Things were simpler back then. They didn't have the internet. We didn't have as much competition. They weren't like writing reviews per se online back then. This is the only thing. Either you liked what you had with your veterinarian and what was given to you, and that was it, and that's all you could do. But that's okay. But we like to talk about progress. I just came back from Disney, by the way, and I love the carousel of progress. And when I go through and seeing all those different things that have evolved, it's pretty amazing. So no pick of the bag phone. Kerry says, I don't have one, but yes, I didn't know if you guys would pick that up, actually. So good call on the bag phone. Oh my gosh, do you remember that? So good. But then, so you go from this phone to the very first iPhone. Oh, something called apps. I used to think they were called appetizers, right? But you had these different apps that are on the phone now. Now you could do something called texting, right? And how weird is it when your phone rings nowadays? You're like, who in the world has the nerve to call? Who's calling me? Just text me, right? But that's just how it is nowadays. We have all these great apps, but then now look where we are with the latest generation of the iPhone, and we could do everything from a camera now. We could take pictures, we could do video, we can FaceTime. The reason why I share that with you now is because look what we can do to empower ourselves with our clients and our pets. How many times do they say, "Oh, they're not doing it for me now. They're not going to show you what they're doing or chewing on their front legs." But if they take video and they show it to you or they send it to you ahead of time, you're going to have that ability to really do a great, thorough, and practice really great medicine, and including a thorough physical exam. Now they have all these different apps that are out there, right? So there's ways in which we can internally communicate with one another. Sometimes on Slack with your veterinary hospital, you have that opportunity to do so. Then also with telehealth and virtual care, you have that ability to talk to clients, not even just within your exam room, but even around the world to communicate with them based upon what you want to do. I just find this is so amazing how far we've come, and I'm excited to see where we're heading with this technology now that AI is on board as well. And so a lot of great things that are on the horizon there. You guys know this, right? This is the stethoscope. And did you know, fun fact, when this was invented, the pushback that people had, medical professionals had of the stethoscope, they said, no one's going to wear this, no one's going to use this. Can you imagine now where we are? Like I go into exam room and I don't have it. I'm always like, oh my gosh, where is it? And usually your technician that tells you where it is, like you left it in room two. But this is so crucial to auscultation and then you can flip over the bell, of course, to really auscultate those deep sounds, those S4 gallop rhythms, for instance, or whatever that might look like. But my gosh, the stethoscope is everything to us. And now look, we have the ability to do esophageal stethoscopes. We could do EKG stethoscopes. We can even have pet parents even work with us to use their smartphones. That's right, their smartphones to help look and do EKG monitoring now. I mean, sometimes I'm still old school. I'll do the leads and I'll do the telehealth, the phone, and I put the phone up to the heart for ECGs or whatnot, or the leads, I should say. But nowadays we have the ability to do this at home where we don't, if we want to try to help decrease some fear, anxiety, and stress in our patients, we have this option, which is so crazy how far it's come, right? Unbelievable. So I want you to take a look at these videos too. So what do you think is going on with this guy here on the left here? This is courtesy of my wonderful friend and colleague, Dr. Fred Winninger. If you're not following him, please do. He's got great content as a neurologist on there, really big. So, fly biting or focal seizures or whatnot, this is something that is very hard to pick up in an exam room. But if this client wasn't able to record this at home, I might have think, oh, maybe it's syncope. Maybe there's other things going on. But now that you're able to make that diagnosis with the power of the phone, that's so crucial, right? And nothing is worse when a client says, Doc, I want you to believe me. I feel like you don't believe me. I don't know if you've ever heard that happen before, but it's really frustrating on both ends because no one wins. And so being that you have documentation, a video, or any of those things, I think it's great. By the way, even cameras, I was just on a lecture at Fetch last month. They were talking about cybersecurity. And so a lot of these cameras are put into the practice, not to look at you, a big brother, but also as liability of what clients may do this he say, she said kind of a thing. So now there's documentation of things that can happen. There was an instance that did happen that they talked about in the lecture, but the client was adamant it was perceived this one way, but when they went to review the videotape, it was shown a completely different way, which was obviously the most important, crucial thing. So even consider those things too, security for your team, for your staff, for your controlled drug substances. I think that's crucial. Okay, take a look at this kitty here. And poor thing, of course, having a grand mal seizure. This owner, these cats can think of, did they put any flea and tick prevention on them that shouldn't have, like inappropriate dosing? Did they get into anything? If this is a cat that's currently managed with phenobarb or any other anti-seizure medication, maybe we can change the dosing around. So, it's always important to know this. This case is, let me see if I can shrink down my window here and see. but you've seen this too, and this is like a head pressing situation where they go into the wall and they act neural, almost like the fainting goat syndrome. And again, another difficult thing that could be described in an owner, but if they say, "Let me just show you what's going on with my dog," you can get an idea. So, okay, let's see if I can find. There is my mouse. Okay, there we go. All right. And then also, this is really important. I just want to hit pause for a second and talk about this. If you're not doing this, please do this. I highly recommend it, especially for your team. Videotape dog and cat gait analysis, either if it's normal or abnormal. Is it neurologic? Is it orthopedic? So take a look at this dog and let me know. Comment down below in the Q&A. Is that a normal gait or is that an abnormal gait? Normal or abnormal? What do you think is going on? And I will tell you, well, let's like pause for a second and see what your thoughts are on this, because sometimes it's hard in these like goofy puppies growing stages. That's like they're not completely, you know, are they completely grown or whatnot? Is it growing pains? But that's abnormal gait. And Dr. Fred Winninger talks about upper motor neuron disease versus lower motor neuron disease. And this is certainly an abnormal gait that's going on with this dog. So certainly neurologic, has some issues. And again, through the power of videotaping, we're able to make a diagnosis or work through a diagnosis to figure out what's going on and localize any potential lesions that are going on with our pets. So I just think that's wonderful. So let's talk about our clients, right? Virtual health, telehealth. I don't know if any of you are doing any virtual telehealth and consults. I do think it's great. If you think about getting a DM on social media from either your friends or your neighbors or clients, to like, hey, let me just send you a picture, and they're flipping the ear and looking to see if this is an infection or whatnot. I mean, listen, nothing is more important, and the most expensive tool in your veterinary hospital is you. You are the most expensive person. So don't ever devalue yourself by any means. So when I talk about virtual telehealth, I always like to use it in conjunction with, not in place of course. But there's times that you could probably think of where you want to recheck a lesion or behavior issue, or starting out with an issue too. If you're doing a grimace scale, for instance, and you see the cat with the ears, they're at a grimace scale of a 2, and they're really straining inside a litter box, and the whiskers are all propped laterally, and their ears are cocked down, you know that they might be blocked. They need to be seen right away. So, but Gen Z, to my Gen Z clients out there or people tuning in, they expect this. In fact, they want this. So what I always find interesting when I give this talk is that your clients are more, generally speaking, more technologically interested in pet care than we are. Sometimes we have our trepidations where we follow this because we're scientists, that's what we look at. We like to follow the data and science, but they are really interested in what's out there for the greater good of their animals. There's even something called Companion, for instance. This is something that uses AI technology through dogs' facial recognition. And this is, again, this doesn't replace the owner, but this works with them for rewarding them for playing games, puzzle enrichments. We always talk about brain activity, making sure that our dogs are not only environmentally enriched, but also mentally stimulated. So you can even do this from afar if you're working or whatnot too. But that's a cool thing that I just always like to bring to your attention. If you haven't seen it, you might see it even more. And then let's talk about this for a second, because the POCUS, the point of care ultrasound, is the new stethoscope. I'm going to say that one more time. The point of care ultrasound is the new stethoscope. And what do I mean by that? Well, again, remember when I referred to earlier that the stethoscope was like, oh my gosh, no one's going to really use this or whatever. And now everyone uses this. This is another tool. I give it by 2030. They're expecting that everyone will be up to speed on just basic abdominal thoracic ultrasound, and do these on animals that are like coming in for your spay or neuter or practicing. Go for CE courses on this. It's not very hard to do the basics, right? I'm not asking to do like, cardiac wall analysis and thickness, but looking for things like effusions or masses, or if you needed an ultrasound guided cystocentesis or something like that. Those are great things to do. It's a great added tool. It elevates the quality of medicine that you're practicing. We talk a lot these days about access to care and spectrum of care, and maybe we can't refer out. It's a few hours away or whatever it is. So we're able to notice some things of an infusion. Maybe we'll be able to tap it and get that dog stabilized for a few hours before we change our treatment plan. So please keep point of care ultrasound on your radar, no pun intended there, because I do believe that it has great value, especially I just gave the commencement speech at Iowa State University this year for the graduates last month. And I was really surprised to talk to them that they are competent in just your basic point of care ultrasound, which is like so exciting to hear. So that's great that they're getting trained up and being schooled up on that. Now, AI is something that we're always a little bit sketchy of, because nowadays we're seeing now like the Chat GPT-4 that's out there, um, and Chat GPT in general, for instance. But AI technology is nice in the sense that it kind of gives you better peace of mind. You know, like I'm always, whenever I have when I'm mentoring the new grads and they're taking x-rays of a dachshund heart, they all think they all have cardiomegaly, right? I mean, some of them can, but like when you do your vertebral heart scores, dachshunds just generally, just because of their thoracic cavity, it always intuitively looks like it's like cardiomegaly. So we talk about these things, but I said, hey, consider using AI technology, because it goes through a huge database of all different sizes of breeds and dogs to compare things with. So maybe you are a one doctor practice or two doctors and somebody's off, and you just want to have better peace of mind. Signal Pet is an example of one of them that has great AI technology. So look into that by all means. And we're also seeing it on the virtual lab space as well, with artificial intelligence in cytology, digital cytology. And AVMA put out a statement too, an article. What are the ethical and legal implications of it? Experts were discussing on it. And generally speaking, they're talking about, triaging workflows by taking a first pass at various imaging, like I just mentioned, prioritizing more critical patients to the top of the queue. So that will do it for you. Your AI could do, say you got a lot of, critical cases that you're taking some radiographs of, it'll prioritize them. But they're not required to undergo a pre-market screening. So that's something a little sketchy on this side. On the human side, they have to. But companies developing the medical devices for animals are not required to undergo pre-market screening. So that means that you just question a little bit on the sensitivity and specificity of the AI technology. So there are concerns for algorithm mishaps, but you recommend to obtain owner consent before using AI. You let them know. Hopefully, you don't use it as your diagnosis. You use it as a tool. And then, one of the things that I recommend to some of the hospitals that I see around the country is that use your reference lab too. There's a good chance that your reference lab has some sort of radiologist that you can pass something over to just to get another pair of eyes on something, or your local radiologist as well. So, use it. Not, but to me, right? This is just my opinion that I'm speaking on. I feel comfortable using it with another tool, such as a radiologist or someone else, not by itself, if that is clear. So, but it is changing the veterinary industry. There's articles that are posted about it, and it's not this fictional idea. Do any of you use ChatGPT? Comment in the chat box if you're using ChatGPT, because I'm just curious to see what your thoughts are on it. And one of the things I'll share with you, if you haven't done this, by the way, I want you to play with this too. So do me a favor, one of your homework assignments after we're done, I want you to go get blood work from one of your patients, okay? Just regular blood work, whatever reference lab you use, whatever it is. Hopefully it's on a computer, okay? I want you to copy it, literally copy the entire thing and paste it into ChatGPT. And I want you to tell me what you're going to see. I'll give you a little soft opening. It's going to give you differentials for pet parents. That's pretty freaking amazing, right? So if there's elevated BUN and creatinine, it's going to talk to you about what pre-renal azotemia can look like versus renal azotemia. So it's not, again, I wouldn't like give that to the owner, but it kind of frames a narration that you might want to consider doing, or writing instructions. Because remember, we all learn different ways. We need to hear things, see things. But do it. It's free. So I want you to like play with it a little bit and see what your thoughts are. Let me know. I would love to hear more of your thoughts on that. Digital cytology has come a long way. We want answers yesterday. And so if we can get something, if concerned about neoplasia, for instance, we can get something in less than 10 minutes. Yeah, let's do it, And because do I have to refer out this possible hemangiosarc? I tap the abdomen, looking at blood, whatever that might be. This gives you a little bit of an indication to see what needs to be done. So I do think digital cytology, definitely for the win. Did I click on this right? Yeah. Let me just go back. Veterinary Practice News also talks about millennials now, the largest pet owner demographic in the US, and they have very, very big expectations, as well as zillennials, Gen Zs. And digital cytology is a logical progression in this trend. So something to keep on your radar, the fact that this generation is aware of this kind of technology that's out there. I was working with Leaf 2 weeks ago. She said, "Do you have digital cytology in this practice?" I said, "Gosh, we do." How did you know? She's like, "No, I was watching TikTok videos about digital cytology and vet med." I'm like, this is just unbelievable. It's great, you know? She's like, "I was hoping you would because I expect it from my dogs." I like that she said that. I expect it. In other words, she knows that's going to give me confidence as well as her confidence in decision making for what we're going to do with an outcome. So again, I think that's just pretty darn amazing. I want to talk about innovation in vet med because when we hear this word, sometimes it can be a little bit on the scary side. But I hopefully want you, when you leave this session, that you want to feel excited. You know, you should be honored to be in this profession. On Saturday, I'm going to be hanging out with 56 students from the ages of 6 to 14 that want to be us. They want to be you and I. They are excited and want to be a veterinarian, and we're doing a lunch with the vet and a tour. Our hospital is located on a farm. They're going to get a tour, but we're going to put them to work. We have our pets, dogs, very friendly dogs and cats. They're going to do physical exams. I share that with you because the technology that we're going to show them is pretty awesome. And what these kids are going to grow up with moving forward into vet med is going to be remarkable, right? So, and this is, we're talking about Gen Alpha. If you don't know, after Gen Z, there's Gen Alpha. And I think this is like, correct me if I'm wrong, I forget. It's like the teenagers right now that are going on. So, you know, those are future pet owners that we want to work and nourish too, but also future veterinarians, veterinary professionals. So hopefully technology should be awesome. Okay, I want you to say yes or no. Do you know what this is? I'm going to put a dramatic pause here because I need to know if you know what this is. Because when I was a kid, this was my job for my dog, that he would get this every day. It was part of my daily duties, right? Teresa says yes. Jade says no. That's okay. Jordan says yes. So these are Polaribus, my friend. These were daily heartworm pills that your dog would have to get. It would come either in a pill form or a liquid form. You would sprinkle it in with the food. The dogs, I don't know how they liked it, but they did. But that's daily heartworm prevention. Can you imagine doing that now? Look what we have now. I mean, of course, the innovation is just incredible. Well, not only if it's just heartworm, we got flea, tick, and intestinal parasite prevention in there, and it's come a long way. So this innovation wheel that I show you, this gives you an idea of when a product comes to fruition. There's going to be a big product coming out this summer. I can't say yet, but it's going to be one that you're going to be like, holy smokes, this is awesome. But it has gone through these 10 types of innovation that is out there. And when we as veterinarians think about when something comes into our hospital, let's just say, for example, you know, like a new service or a new product is coming in. So let's just say shockwave therapy, for instance. So, you know, we're thinking about getting shockwave therapy. Well, what's the cost? That's the first thing. Then what's the benefit? And you're also going to think about how can we better serve our clients and our pets' needs? Do we need this? Do we want this? And what I love to do, and I want you to write this down, by the way, is please poll your audience on social media. Get their buy-in. So what you're doing is on the blue here or purple is customer engagement. You're going to want to get their buy-in. Say you already know you're going to get shockwave therapy coming in. It's all going to happen, but you want to get their buy-in first. We're thinking of getting this pulse vet shockwave therapy. You can click here to learn more, but what are your thoughts? Would you be interested in this? Yes or no? And you're going to get a poll on your Instagram story of good tangible data. They might not be all your clients, but you're creating free marketing for yourself. You're already differentiating yourself from others that are in the area that may be competitors to you. So you're already right then exposing something that is completely innovative, thinking outside of the box. And those are the clients that you want. Those cheerleaders are really going to become your brand ambassadors for your hospital. About 20% of your clients are going to make up for 80% of your revenue. So you're really going to want to nurture and build those 20%. They're going to answer. I'm telling you, they always do it in our practice. You have the same one. We have some cheerleaders that are here on this webinar this evening, which is awesome. So thanks for being here. But I share this because it's a lot of work that goes into experience, configuration, and then offering it. And in our world, in vet med, we have products and we have services. And the next thing you always think of is the how. But the most important thing is how are we going to do this? But how do we get the buy-in from the team? I never forget when I was at a doctor's meeting, my other practice, before I came to DVM 360, we had 12 doctors, enough to have differences, right? And so we had this one doctor's meeting. We're like, we pulled down the shelf. I like, let's take a look at all the ear antibiotics we have. Let's take a look at all the heartworm preventions. Like, why do we have this? Someone likes this because it's chewable. One tastes better. This one has a non-steroidal, whatever it is. It was unbelievable, right? So we come together. It's like, okay, let's see what are the best offerings to the yellow that I'm pointing to over here that we can provide our clients because we're creating so much noise within ourselves. How do we get the buy-in from the team? So really narrow your things down a little bit. But when you get a product or service, get them excited. Think of it like a pre-screening for a gym membership. When a new gym opens, they're going to get obviously members involved right away. You want to get excited at launch day when Simparica first came out years ago, when it was just a regular Simparica. We had like a huge party for it. We get people excited. We got the community involved in it. So think about those things when you're thinking about getting some products or services in. We asked the audience, our followers, on would you feel better if your pet was less disturbed in recovering from anesthesia? And every single one said yes. And the next story would say, wouldn't it be cool if there was something to help minimize fear, anxiety, and stress while your pets are recovering from anesthesia? Again, everyone said yes. And the next Instagram story is we're thinking about getting Vet Guardian. And I'll talk about that in a second. But already you're name dropping something, they're looking it up. Would your dog and cat be interested? And they all said, heck yes, because we did put heck yes to it. So again, it's just another thing to get their buy-in on these things. Okay, I want to pivot a little bit and let's talk about what pet owners are looking at because the technology is huge. Or maybe you have these. There's I was going to say the Roomba. I don't think that's the Roomba. Is it a Roomba? No, those are automatic ward dog feeders, is what they are. And then the water ones are in the background that are there too. I share this slide with you because you may not know that your pet parents are using these things. Sometimes they're afraid to ask you or they feel intimidated. There is nothing worse than a pet owner being shot down, feeling like disencouraged, although their intentions are so good to find and identify a product that's really meaningful and purposeful. But if we say, oh, that's garbage, don't use that, they're like, oh my gosh, I feel terrible. So try to like work with them. Thank you so much for getting this. I see that you're interested in making sure that Fido's food is measured. I think that's a great idea. Let's just see how it works. So any of those things are great, but like don't shoot them down because they're really into this technology. Let's look at the PurFlow Smart Water Fountain Dog and Cat Feeder. For $30, you can also, get it cleansed by using your smartphone. Pretty darn cool. I mean, these are just things that are out there. I was at, Have you ever been to Super Zoo? Those of you that live in the US, an annual meeting of all these great consumer products that are in Vegas at the end of August, and they launch all these great innovative devices such as this one. And it's just like, I don't want to say it's like 2 or 3 thousand products that come out. It's crazy. So Furbo, I'm sure you've heard of Furbo. Those are the ones like me. Like I go on vacation, I miss them so much, but I want to see them on camera and I want to give them something to eat or drink or a treat. But this is something that you get. And listen, $199. This is one of the number one pet selling items that are out there. It's a two-way camera and it also has the ability to drop a treat. Pet parents will spend this money. This is the human animal bond in 2024, my friends, right? This is expected. I mean, they're not dogs, they're your kids. They're traveling with them, they're taking them to pet friendly hotels for vacation. They're going to doggy daycare, they're getting spas. I swear that Instagram and TikTok were made just to show off our pets because I'm guilty as charged. 3D printing is another big thing that's out there. Have you guys ever I don't know if you ever had to work on a case where you can get something 3D printed made, but Dr. Whittinger, I alluded to earlier, he owns a 3D company, is a neurologist, and the amount of work that he does with 3D is pretty remarkable, right? That's just nuts. So he offers, and also if you're ever interested, he offers the classes on 3D printing because it's really not. He says it's not really. I mean, he's just a brainiac. He's so smart. But on the human side, they're using it. They're using it for intervertebral, like for discs, for teeth, ears, skulls. It just a lot of great stuff with 3D printing that are being used a lot. When you think of the brachycephalic breed, every time I see the skull, I always think of the movie Predator. I think this is where they got their inspiration from. Susan, I know you love your French bulldogs, but I think this is where they got the origin of of the French bulldogs from Predator. They're so cute, love them. But anyway, we all have such anatomic size variations within our dog breeds. So look what 3D printing can do. Even if there's a craniotomy and they need to do skull reconstructive surgery, 3D printing is there for them. So it's pretty remarkable. So the U.S. share of pet owners is pretty remarkable here. So the as you can expect, millennials have more of the income. An interesting trend, if you don't know this, that millennials are now and zillennials are now purchasing homes for their pets. So they're looking to see what the backyard looks like, what the windows look like for their cats. Do they have access to go on walks? What do the sidewalks look like? So it wasn't like that even 10 years ago. I mean, so the general consensus is they get a pet, then they'll have a child potentially, or maybe their pets will be their child indefinitely. Same thing goes for the car industry. They're looking at cars that are also safe for their pets. How many of you, as veterinarians, do you see your clients struggling with their very large dogs, trying to go out the back of the truck or the car? Now they're working on building ramps within the car. They hit a button and the ramp slides out. So lots of cool stuff heading in the car industry because of our pet owners. We know and recognize that we're traveling a lot more with them. And so Gen Z pet parents, get a little of this. 81% celebrate their pet's birthday. Do you guys celebrate your pet's birthday? Yeah, you should, right? Or their gotcha day. 43% dress up their pets, guilty as charged. I definitely do that. When you have dachshunds, it's part of their DNA. 46% say their pets make them feel safe, which is so true. And 83% embrace wearables, virtual care technology for pets. 83%. That's higher than celebrating the pet's birthday, right? Insert dramatic pause because I'm leading to something great here, my friends. The fact that they're already there. They're already there with the technology. They're interested. They're looking. They're Googling things. They're hearing things from Facebook groups. So I think it's our due diligence to make sure we meet them where they are. And the value of pet care market for veterinary care and grooming and boarding. Look at this. My goodness. Oh, it's going to approach almost $40 billion by next year, which is, look at 2050. This is just a 10-year difference. So huge in terms of the vet med space and pet grooming. Now listen, fun story, you guys. This is what I tell. When you own a dachshund, there's three different types of dachshunds. There's a smooth, the long, and the wire hair. And when people ask me, like, Dr. Christman, what kind of dachshund I should get? I should definitely start out with the beginners. So the beginner group is the smooth dachshund because it's less maintenance. Long hairs gets groomed every now and then. Then the wire hairs go for more haircuts than I do. They go every 6 weeks. They're on a subscription plan. What? But I want to think twice, because I know what I signed up for as a responsible dog parent. I know that the wire hairs, they get stripped, they have to have a certain way about them. And so that's just what you do. But grooming, my gosh, big shout out to our groomers. Thank you for all the great work that they do. I don't know what we would do without them. But look familiar. They're either doing this in your exam room, they're either price shopping, which you already just recommended. It could have been a food that you're recommending, or they're thinking about getting something for their pets. They're looking online, they're price shopping, they're already there on the technology side of things. I just happen to look at wearables in general. If you go ahead and do a Google search, I literally just typed in pet wearables. Look at all these different ones that are out there. Do you use a pet wearable, by the way? Do any of you guys use a pet wearable? I'm curious to see. Or do you have clients that use pet wearables? Um, I tend to see in my neck of the woods here in New Jersey, yes. My answer is yes. They definitely are using some form of a wearable that's in there. Lark says yes. Thank you, Lark. And so my question to you is, how many do you think? Oh, I'll get to that in a second. But there's quite a few. But this is what they're looking for. So when you think of wearables, they're thinking of safety. Heaven forbid their animals get lost. Okay. Medical diagnosis, monitoring treatment, tracking security, well-being, and gathering health data. Some of these will monitoring scratching or movement, I should say. And that movement could relate to scratching. Maybe we need to change the dose of Apoquel or Cytopoint, another injection of it. Or maybe we change some anticonvulsant medications because they were having seizures, maybe whatever that might be. But I'm curious about safety. But I always tell the pet owners, I know you'll agree with me on this, is it does not replace the microchip, right? Because that microchip is in there. It's their social security number. But this is great. Don't get me wrong, but you got to make sure, one, it's on the dog, and two, it's charged. So I saw one dog, I was doing an exam. I was like, is this on? Because she's like, no, I forgot to charge it. I was like, oh, it's a good time to do it because, heaven forbid that they go lost or missing, whatever, you got to make sure it's on. So, but the pet wearable market is huge. I'm so surprised that it's going up because I would have thought it would plateau just because there's such a saturation of it. So when you're looking at this screen, you're looking at RFID, GPS, and sensors. So if you've ever been to like Disney and use the Magic Band, that's RFID technology. So it's able to help track certain steps, calories burned, for instance, on dogs. And there's sensors and GPS, of course. GPS tends to be like the hot one. That's the reason why a lot of pet parents decide to get the wearables. But I want to make sure that you're familiar with that because wearable marketing is, look at this, almost $700 million. And this is 4 years, 3 years ago. And they're looking for things as, medical diagnosis and treatment. So when I see medical diagnosis treatment, I'm assuming that it's obviously not like your dog has separation anxiety. These are signs that are leading up to a diagnosis. So it could be something like behavioral changes, for instance, or seizures or itching or whatever that might be. And safety and security, that's what we all want. We want our dogs and cats to be nice and safe and secure. So anything that we can do to help them. And behavior monitoring control, I think is good. They also have trackers that can tell you how much water they consume. It can register to the water, which is pretty crazy. Okay, so how many pet wearables do you think there are as of December 2022? My gosh, how many do you think there are? Well, the answer is there are 285. I just looked before I went live with you guys. There's 310. Nuts, right? So my next homework assignment for you is I want you to have a doctor's meeting about this. And as a staff and as a team, I want you to come to the table and choose a couple that you would recommend. Maybe make this as a PDF or a social media play to be like, here are some ones that we recommend. And do the research yourself, but I'm going to do it for you. That Fi or Fee was one of them. This is a great chart if you want to get a screenshot of this one, but this gives you a good idea. The number one thing you're going to look for is battery life. That's a big thing, because owners were busy lives. We forget to charge the drive, forget to charge one damn phone in sometimes. So GPS location is a big thing. So Fee or Fi and Whistle tend to be good ones, and Tractive is another one. So those tend to be the top three that I usually recommend. But there's other ones that you might find different, and go for it. But I would choose a few because pet owners are going to ask you about it too. And so the reason why we're hemming and hawing on this is because pet owners are all aware about this technology and they're confident in it. They expect you to be aware of it too. And so they want their veterinarian on the other end of that hospital when their dog goes off to get spayed, to get a dental cleaning, whatever that might be. Sometimes you have drop-off appointments for a workup case. They're expecting that technology to be just as valuable. Maybe it's AI radiology, maybe it's digital cytology that we just talked about. And what if our animals are getting surgery and we want them to be nice and comfortable? So patient care also has to be innovative. And the human animal bond is at its peak right now. Look at this poor dog. Look, look at the amount of, I don't know if you can hear me, but look at the amount of leads coming in. This is a dog that was recovering from surgery, neurosurgery, Dr. Wininger. And of course, you have CRI pumps, you have multiple things going on in this dog. So a lot of things happening, a lot of things that can kink and beep, and it could be somewhat, frightening to the animals as well. Dr. Mariana Pardo aborted critic list. I mean, this is all from one patient, all hooked up to these monitorings and multiple transfusion. Things are happening here left and right, of course. So and you have to make sure that you're aware of what's going on. But what if we can maybe better utilize our patients a little bit better? Because we know if you were a technician, I always ask the technicians, how are your knees doing? Your knees, because we're always bending down, wrestling these animals, and nothing is more annoying. I don't know if you can see my pointer, but hitting your head. Has anyone hit their head or their back on one of these cage doors? Oh my gosh, you see stars. So, again, safety issues. And then, of course, some of these animals may bite. they just genuinely might. And that's a liability for your practice. You have a team member that's out, and now you're kind of, screwed or whatever. So you worry about their safety. So let's try to think of some ways that we can kind of help minimize those things. And the other thing that we have an issue in vet med are medical errors that can happen. Did you give the milk? Did you give the pill? I don't know. It was, maybe erased off the dry erase board. Sometimes there could be oversight. Maybe you're not rounding if you have overnight care, for instance. So there can be issues, and this is a whole nother topic about medical errors in general. So we want to try to capture things in real time as best as we can. This goes for heart rate, respiratory rate, temperatures. Sometimes we are busy, we forget to log those in. And what happens if it's a liability case and they want to see those records, and how come it wasn't documented at 2 o'clock in the morning or whatnot? So these are some real concerns about patient stress and team utilization, improving our safety as well as efficiency. And we want to differentiate ourselves. We opened up this discussion by talking about innovation. It's a great time to be a veterinarian. You're not supposed to stay stuck. This is practice. You're supposed to move with the times, right? Can't stress that to you enough. That's why you go for continuing education. It's good to refresh on certain things like the kidney or whatnot, but then you also want to see what's out there and what's new and how can we enhance patient care. So super important. And, we want to remove some of those care instances because maybe we can better utilize our technicians to go elsewhere for certain reasons. Maybe we're feel-free hospitals and we want to try to minimize touching them while they're recovering from things such as a dental, a spay, or neuter. And we certainly want accuracy and precision when we're documenting things. So, with that being said, I do think that one thing for you to consider, and get a screenshot of this, or you can look it up on YouTube, is the Vet Guardian. I think this is truly what I love game changers. Or if you watch if you watch Shark Tank with Lori Grenier, she'll say, this is a hero, this is a zero. Well, this is a hero. This is definitely a hero. And Dr. Fred Winninger, neurologist, who I talk to a lot about him, he has this for his practice as well. And it takes core temperatures, pulse, respirations, and movement. And so it does micro movements of the carotid arteries and lungs, and it's converted into a pulse and respiration that's there. And this is what it looks like. So this uses the Wi-Fi technology around the hospital. So you don't have to be in the back of the counter. You could be upstairs doing your records or whatnot. And there's a camera that's right here that's on the dog, and it measures your TPRs right here, for instance, and then also is documenting them throughout the duration, which is pretty amazing. So you zoom in a little bit further. It can also, you can set the alarm or bell to whatever you're interested in doing. And then it can also put notes in as well. And the client can get a copy of this if you're interested. So, it removes that unnecessary contact with the animals. It has that camera that's right on in there. It can alert if anything's going on, and it can generate about 50K per year in new revenue, which is great. Now, how do you charge for this? Well, what's your patient monitoring and recovering fee look like? Now, this is me being the practice manager, so I give a lot of practice manager talks. You never want to really a la carte somebody for things anymore these days. Nothing is more annoying. Like when you look at buying a car, they have everything itemized. You want to include it in because you want to show good care. So I would envelope this into either a surgery, either anesthesia, but I think this is perfect, right along patient monitoring and recovering. And what you're going to do when you get this is you're going to journey the visit of the dog or cat coming through, and you're going to show the owner what that looks like. Because when they see the patient monitoring recovering fee for whatever dollars that is, it's going to add better value and peace of mind to say, oh, that explains it. That's pretty cool that you had that monitor on the all times. So will remember your settings. It's got 2-year warranty. You have the VetGuard monitor that's there, and Susan on the call, she can always help you out with further information on it too. It does core temperature, all that fun stuff. This is always important. And I, again, like having the alert. It's very clean and seamless, which is nice. And it doesn't take a lot of time to put the patient information in for you guys. It has the alarm that's there. And again, you could put anything else like that is there. But look at this nice printout that you get. So it'll tell you everything from TPRs and when they were being monitored or whatnot. It does a nice little picture of them, nice little report card. I'm sure some of you do report cards. A lot of clients love it, especially if you're in doggy daycare. They love a report card on how they did. So that's nice added peace of mind and great medicine. So it adds good value to your hospital. I love the social media play. You could actually, what I did is I talked to the camera as if that was the dog going through the procedure. So I said, and you can watch my TikTok videos on this. I said, "Oh, you're about to go through anesthesia. Let me show you what's going to happen for the rest of the day and where you're going to end up. Come along with me." And it really means well because it takes away that stigma of what the back looks like, so you can show them what that journey looks like. And of course, give them a hospital tour and show them any of the bells and whistles that you have because, they get the buy-in. So, as we're wrapping up here, why is this so important? What clients are asking for it. I already showed you the data. Gen Z and millennials are already there with you. So when you have some sort of technology that's there, they're going to be along for the ride. They're not going to give you pushback on something like this. I say better flex scheduling, noticing that you can better utilize your technicians a little bit more. So maybe they can still be around if you need them, but they can do callbacks for something else or refill prescriptions. And you can monetize this and improve your workflow without the technicians maybe having to be on them all the time. Because we know that a lot of accidents or issues that can happen could be in post-op recovery. So keeping extra eyes on them through a monitoring system that's accurate with precision is important. And wearables and remote monitoring can go hand in hand. They know about the behavior changes that can be associated with. They know about RFID technology. So why this is no different than what we're talking about in terms of advancing technology together on both sides of the exam table. So, I like the freedom of working from areas of the hospital. Nowadays, I'm sure many of you can look up blood work while you're home. That's like awesome, isn't it? Just knowing like you can maybe do your callbacks from home if you'd like to. Maybe sometimes it's just too crazy at work and you want to have one-on-one time when you have to talk about the low dose dexamethasone suppression test. It's probably 10 times you talk about a day, and you want to just have that undivided attention with the client. So these are another good reason for you to have work areas from the hospital. So I do want to thank you. If you want to know more about this, I put Fred's information on there too, because he is such a great, valuable resource. Follow him on Instagram. Follow me too. I have my website too, dradamchrisman.com. My Instagram is there, Adam_Christman. And I do have other handles as well. On TikTok is where my home is at. And we're hosts of a podcast called the Vet Blast Podcast, as well as a talk show called DVM 360 Live. By the way, on DVM 360 Live, there is an episode with board certified surgeon Dr. Courtney Campbell, who talks about Vet Guardian. And it's like a 5-minute snippet. So if you want to know more about it, he explains it from his perspective as a surgeon. Check that out too. So that's on DVM 360 Live. And I'm sure Susan can send you the link if you're interested.